Hello, my name is Fatima Magram. I'm a second year student. I'm gonna explain you about the Digitalis, which is a drug also known as the cardiac glycoside and the digoxin. So, what are cardiac glycosides? Basically, they are found from the plant sources, Digitalis lanata and Digitalis purpura. Animal sources from the toad skin, bufotoxin. Now, cardiac glycosides are naturally occurring compounds with positive inotropic actions, means they increase the myocardial contractibility and cardiac output in a hyperdynamic heart where the patient's heart is not able to contract properly. And the only glycoside, digoxin, is the only glycoside which is used, clinically used. Digitoxin and ubine is not clinically used. With the available formulations like 125 mg and 0.05 mg per liter in the pediatric solutions. It's a cumulative drug, means it has a cumulative effects where slowly the drug causes the toxicity. So pharmacological actions, effects on the heart, increases the force of contraction, positive inotropic action. So myocardial contractibility increases in the hyperdynamic heart, reduces the heart rate, where the bradycardia, and more marked in the congestive heart failure patients. Mediated by increase in the vagal tone increases. Vagal mechanism, reflexive sensitization of the baroreceptors, which are the pressure receptors, plus the stimulation of the vagal centers, which is not reversed by the atropine, which is also a drug. Extravagal actions, direct depressant effects on the SNI AV node. This action is not reversed by the atropine. So, how digoxin works at the cellular level? Mechanism of actions. So, digoxin binds to the sodium potassium ATPase pump, which leads to the blocking of that pump. So, which leads to the increase in the sodium intracellularly inside the cell, and this leads to the reducing in the sodium calcium exchanger activity. Thus, as a result, the calcium inside the cell also increases, and because of the calcium more available inside the cell, so the stronger systolic contraction occurs. Now, systematic effects on the blood vessels, kidneys, and CNS. So, what does it do to the blood vessels? So, causes the direct vasoconstriction to the blood vessels, and CHF patient causes the improved circulation, which is impaired in the patients, and it only changes or it only raises the systolic blood pressure. It does not affect the diastolic blood pressure. Sometimes also reduces the diastolic blood pressures, and it is not contraindicated in the hypertensive patients. Effect on the kidney. In the CHF patient also, yes, it causes the diuresis secondary to the renal perfusion, and retained salt and water are gradually excreted. No diuresis occurs in the non-CHF patients. Third, on the CNS, it causes the CTZ stimulation at the higher doses. Nothing happens at the minimal effects at the therapeutic doses. So CTZ is the chemoreceptor trigger zone, which causes the nausea and vomiting. Toxic doses cause hyperapnea, which is the increase in the breathing rate, sympathetic stimulation, confusion, and the visual disturbances. Now, digoxin absorption, disturbance, and distribution and dosing. Pharmacokinetics, basically. So, absorbed orally, where it is taken orally, and oral bioavailability is variable. Distribution concentrated in the heart, liver, muscles, kidney, etc. Accumulation it is a cumulative drug, so it has a cumulative effect, and the cumulative effect which leads to the toxicity. And available formulations 0.25 mg tablets and 0.05 mg per milliliter in the pediatric oral solutions. Now, adverse effects of the Digitalis. Extracardiac, which is the early warning signs, which are anorexia, nausea, vomiting, CTZ stimulation, of course, then abdominal pain, gastric irritation, mesenteric vasoconstriction. Cardiac, serious. Almost any arrhythmias can occur. Pulses, meningitis, nodal and ventricular extrasystoles, and ventricular tachycardia, ventricular fibrillations also. GI symptoms are often the first sign for the toxicity. Monitor closely before the cardiac effects occur. So contraindication, precaution and contraindication. So hypokalemia is a precocious condition for the digoxin, where it is most common precipitant of digoxin toxicity. And first of all, we need to correct the electrolyte. And also it's contraindicated or precocious in the elderly and renally impaired patients, where lower doses are required, and flows monitoring also is required. And also in the WPW patients, is the WPW syndrome, Wolff-Parkinson-White syndrome, where digitoxin may accelerate conduction via the bypass tracks. Acute myocarditis, which is the diphtheria caused by the diphtheria and the rheumatic infections, poor anatropic response, and high arithmetic risk. Now, therapeutic uses, clinical indications for the Digitalis. Congestive heart failure for the systolic dysfunction, and with reduced ejection fraction, it improves contractibility and reduces the symptoms. Less effective in the isolated diastolic dysfunction. This is very less effective in the diastolic dysfunction. Atrial fibrillations. So slow ventricular rate by increasing the heavy nodal refaction via the vagal tone enhancement. So vagal tone is also increased. First line for rate control in the atrial fibrillations in the CHF patients. Other is known as atrial flutter, paroxysmal supraventricular tachycardia, particularly when associated with the heart failure.